Hey, my name's Kara and I'll be your nurse today. Can you please tell me your name?
Hayden.
Hayden. Okay, I remember you from before, Hayden. Welcome back to the office. So today what we're going to be doing is we are going to be doing an assessment of your cardiovascular system, your respiratory system, and your peripheral vascular system, okay?
All right.
So your cardiovascular system includes your heart, your respiratory system includes your lungs, and your peripheral vascular system, well, that will be like your lymph nodes, your pulses, good things like that, okay?
All right.
So for the first part of this assessment, I'm going to ask you to actually turn around.
All right.
And we're going to start with an inspection of your back. Okay, so I'm going to have you scoot forward just a little bit. Perfect. So what we're going to be doing is inspecting the skin. So when we're looking at the skin, we're looking for any lesions, any abnormalities, any lumps, anything that is not normal. So we don't notice any tenderness, or have you had any tender areas?
No.
Okay, so we don't notice any tenderness. We don't see any reddened areas other than maybe a scant bit of acne, which is normal for people his age. He's a 17-year-old male, so that is normal. So what we're actually going to be looking at now is we are going to be looking at the symmetry. We're looking at shoulder symmetry. We're looking at his vertebral column, which appears to be midline. He's not bent over, so it's kind of hard to tell, but it does appear to be midline. So now we're going to do a little bit of palpation. So we're going to be feeling, start above the scapula with our thumbs, and we're just going to feel down. And you tell me if you know any tenderness when I do this, okay?
Okay.
Do you feel any pain or anything like that when I do that?
I don't.
No? Okay. So I don't feel any lumps or lesions or anything like that when I do that. So that's what you want. He doesn't know any tender areas, so that's good. So now what we're going to do is we're going to be assessing his chest expansion. We want that to be symmetrical. I'm going to find his T10 is thoracic vertebra, but about the T10 region. So we're going to try to get in that area, and I'm going to pinch his skin a little bit. Now what I'm going to have him do is inhale, take a deep breath for me. Good, and my fingers separate. Exhale. Perfect. And you know, even expansion of my hands, I'm not sure if you can see that, but even expansion indicates that he does have chest symmetry. Good job. Okay, so taking an inspection, we felt, we palpated. Now we're going to be listening for his tactile fremitus. So when we do that, we're actually going to be assessing for the vibrations when he speaks. So I'm going to have him say the phrase 99, and we're going to be feeling for bilateral vibratory evenness. All right, go ahead and say 99.
99, 99, 99, 99.
Not quite so fast. Let's slow down just a little bit.
99, 99.
Okay, so we do note that he has equal vibration on both sides when we feel. Good job. So now what we're going to do is we're going to actually auscultate. So we've palpated, inspected, palpated, and then we're going to auscultate. Okay? Ooh, we got to percuss. We got to inspect, palpate, and percuss before we listen. So we're actually going to go ahead and we're going to do a percussion. We're listening for the resonance. Okay? So what I'm going to do is place my hands on your back and I'm going to tap, okay?
Okay.
All right, you're going to feel some tapping. Okay, so we did not hear any hyperresonance, so we didn't hear any high-pitched tones, and we did not hear any dullness. So we're just looking for that normal even tone of resonance, which we hear. So thank you. So now that we have now that we have percussed, we're going to auscultate. So then we'll just go ahead and take a listen, and if we thought that there was an area that was a little more high-pitched or a little bit more concentrated, then we would do something when we assess for his egophony. There we go. We'll be assessing for egophony, okay? And I will explain that in a moment. So we're just going to go ahead and take a listen. Take a deep breath in and out for me. Making sure to breathe out through your mouth. Try not to make any audible noises when you exhale. Do you need a break? Are you doing okay?
I'm good.
Okay. Okay, so we note clear sounds, clear lung sounds throughout all lung fields. But if we did have an area where we thought there was a little bit of a concentrated abnormal sound, we would check for agophony. So when we do that, we would listen for him to say the word E, or not the word, but the phrase E. And when he does that, you might hear an ah or a ba sound if it was abnormal. But otherwise it should sound like an E in normal lungs, okay? So I'm gonna go ahead and demonstrate this. So go ahead and say E for me.
E, E, E,
Not quite so fast.
E.
Okay. So I don't notice any ah or ba sounds when I do that. So we're good on the back portion. All right, so I'm gonna have you turn around for me real quick. Okay, let's make sure you're still on the camera. Yes. So I'm actually gonna have you have a seat.
Okay.
So we have a chair to his right. He's gonna pull that out and have a seat. Make sure you back the chair up some for me. Good.
Okay.
And have a seat. So now what we're gonna be doing is looking at his neck, and when we look at the neck, we're gonna be checking for his jugular vein and also his carotid artery. So I'm gonna have him look to the right. We're gonna be checking for jugular vein distension, okay? And I'm gonna just be looking to see if I see your jugular vein. Now when he does this, I'm looking in the light. I do not note any jugular vein distension. I don't see a pulsation or anything when he turns his head to the right. Go ahead and continue turning your head to the right. I'm actually gonna palpate, so I'm gonna feel for your carotid pulse and your carotid artery. Okay. And I'm gonna go ahead and listen to that. Okay, no bruise noted. If we did hear a bruise, it would indicate some stenosis of that artery, and we wouldn't want that. So you're good in that aspect, okay?
Okay.
So now that we've taken a look at the neck, we've inspected it, we don't notice any scarring, redness, rashes. Have you had any issues with pain in your neck or anything like that?
Nope.
No? Okay, no tenderness if we were to touch or anything like that. Okay? So now what we're going to be doing is looking at the anterior chest, or his precordium, as we would call it. So when we're looking at the precordium, we're actually looking for any heaves or any lifts. And we would try to look for those in 5 key areas. We would have the aortic area, aortic, pulmonic, Erb's point, the tricuspid, and the mitral area. And we would also be looking for the point of maximum impulse, which would be down here, okay? So when we're looking for the heaves and lifts, we're looking for any vibrations or pulsations. If you'll hold still for me, hold your breath just a second. I don't know any vibrations or pulsations looking at those areas, okay? So now what I want to do is we're also looking at the skin. So when we're taking a look at the skin, we're checking for the same thing we would in the neck and on the back. Lesions, lumps, bumps, rashes. We do note a little bit of acne. Like I said, pretty normal for his age group. Okay, so no problem there. And we're just taking a look. Okay, now what we're going to do is we're going to palpate, because we inspect, palpate, percuss, auscultate. So now what I'm going to do is feel the 5 points. And I'm going to be feeling for any, let's feel. First intercostal space, second intercostal space. So we're just feeling for any lifts or thrills. And his PMI is a little bit difficult to palpate, but I do feel it. And with that PMI, if you were having trouble palpating it, you would actually have the patient lay on their left side so that you could access it better. It actually kind of fixes where the heart is in respect to the chest cavity. So it actually brings it forward a little bit, I do believe, when you lay them on the left side. And then also, if the point of maximum impulse exceeds 3 centimeters, then you would possibly be looking at maybe some left ventricular hypertrophy. But for him, it's a small area, so we're not concerned about that. Okay? You doing okay?
Mm-hmm.
Good. So what we're going to do is, now that we've felt, we are going to go ahead and listen. So I'm actually going to be listening to the 5 key areas with the diaphragm of my stethoscope and also the bell. I'm just going to take a listen. Okay. Good. Now, and if we were to assess lung sounds on the front, we would do the same thing. Just go ahead and take a listen. In fact, I'll go ahead and do that. Take a deep breath in and out for me. Open your mouth. Good. Good. Make sure you breathe out of your mouth. Okay. Those lower lung sounds are very hard to hear on the front sometimes. Okay? You still holding up okay?
Mm-hmm.
All right. Now that we have inspected, we have palpated, we have auscultated, what do we need to do next? I believe we have an inspection of the arms, don't we? So what we're going to do is we're going to take a look at the arms. Okay, hold your arms out for me.
Okay.
And what we're looking at is we're looking at the skin on the arms. Does the skin, same thing as the assessment everywhere else, when we look at the skin, we want to look for any lesions, lumps, bumps, tender areas. Okay, when I'm looking at them, I don't notice anything like that. I don't notice any scar, and I'm going to have your arms be flipped over like this for me.
Okay.
No, other than the occasional bug bite, he does have a few on that right arm. If I was making a note and wanted to be very detailed, I could put that in my nurse's note. Okay? You're good. So now what I'm going to do is feel for warmth. I would use the back of my hands and feel bilaterally for warmth on his hands. Okay? And his arms, excuse me. Feel for his arms, and he's warm bilaterally. And I would also check his radial pulses. So I'm going to have you hold your pulse like this. And I'm going to inspect these. Palpate them. And they're bounding. Excuse me. They're a 3+, so they're normal. Okay? Alright, and then I'm going to check your capillary refill.
Okay.
In your thumbs. Hold your thumbs up like this. And we want to blanch them, and we want that color to return after 2 seconds. Good. So we do see that. Less than 2 seconds. So now for this next portion, we would actually, we're going to palpate your lymph nodes, okay?
Okay.
So hold your arm out. Let's do your left arm. How about that?
All right.
So when we look at the left arm, we are looking at the epitrochlear lymph nodes on this side. And we just want to feel. Lymph nodes are non-palpable. We're going to do your, well, actually go ahead and do your excuse me. We're going to feel these under here. Infraclavicular lymph nodes. Non-palpable. Hold your arm up for me.
Okay.
And we're going to feel for axillary lymph nodes. And they don't feel any of those, okay? Those are non-palpable. So now what we're going to do is we're going to inspect his lower legs bilaterally. And with the camera, it's actually going to be kind of hard to see this. So I'm just going to kind of talk myself through it. And what I'm doing this, I'm actually going to, here, why don't you stand up for me?
All right.
Why don't you stand up, and we'll move the chair to the side.
Okay.
Okay? Go ahead and stand up against the wall.
Ready to sleep.
Perfect. So with this, you can actually see when I'm checking for edema. So with the legs, we're looking for any edema. Like we didn't see any in the arms. We're looking for edema in the legs. We're looking for any abnormalities in color of the skin. We don't know any of that. And we are checking. We're going to check for edema. So I'll put my fingers right here for about 5 seconds each. Just release. We don't know any edema. Okay. So now for those feet, we're going to check those pulses bilaterally and the cap refill. So pulses are 3+ bilaterally. They're normal. And the cap refill is less than 2 seconds. All right. Well, thank you, sir, for your time.
Mm-hmm.
Hope you have a good afternoon.
All right, you too.